Breast augmentation is the most commonly performed procedure that I do. There are a number of decisions that have to be made when considering breast augmentation. One of the very first decisions that has to be made is which style implant you want. And your options are either saline or silicone. Silicone implants have made dramatic improvements in the last 20 years. The new silicone implants have a very cohesive gel. They're almost like a gummy bear. If you cut the implant in half and squeezed on the implant, the gel would actually bubble out like a gummy bear and then pop back in when you release the pressure. This makes for a much more aesthetic result. The implants are softer, they're more natural, they look better, and they feel better than with the saline implants. The saline implants are filled with water, basically a salt water solution. The advantage of them is if they rupture, you know it right away because you basically go flat. Both implants are guaranteed for life, which means if either one ruptures or leaks, the company will replace it for free forever. And if it happens in the first 10 years, they'll pay for the surgery too. Now, as far as size is concerned, as I'm sure you are aware, or most of you are aware, is that they don't come in cup sizes. They come in volumes or cc's. And the way we have you choose a size is we actually have sizers here. So you can try them on, look in the mirror, and see what look you're most comfortable with. And I think that's the best way to get the look that you will like the most. We also have 3D imaging. So once you've chosen a size, we take 3 images of your chest, put it on the computer, and it recreates an actual 3D image of what you would look like with that particular style and size implant once you've chosen it. Now, as far as the surgery itself is concerned, the surgeries are performed here in our office. They take less than an hour to do. They're performed under IV sedation, which means we put an IV in, give you a combination of medications that just really put you out in a very nice, comfortable state where you're not aware of anything that's going on. And then the other nice thing that I do is that I numb up the whole chest with a local anesthetic. And the nice thing about that is when you wake up in the recovery room, it's still numb, so you don't wake up in pain. And if you stay on top of it with the narcotics, it's very manageable. Most people, a week off of work is plenty. I don't think you'll feel 100% in a week. I think it takes actually a good 6 months where you feel totally normal again, where you just don't even notice the implants and they feel like they're a part of you. As far as placement is concerned, I do recommend putting them under the muscle. And when we say putting them under the muscle, we're talking about the pectoralis muscle. The pectoralis muscle is a triangular shaped muscle. So when you put it under the muscle, it's just the top half of the implant that's sitting under the muscle. Putting it under the muscle does 3 things. It does keep the implant softer. There's less risk of capsular contracture or hardening of the breast when it's under the muscle. They tend to look more natural. It gives a more natural slope or transition from the nipple all the way up to the clavicle. There's less chance of seeing or feeling ripples when it's under the muscle. And eventually when people need mammograms, it's easier for them to get a mammogram when it is placed under the muscle. As far as incisions are concerned, my usual recommendation is a crease incision, but you have the option of going through the areola or even endoscopically through the armpit. The results are the same through all 3 incisions. It just depends on where you want the scar. As far as recovery is concerned, after surgery we have a separate recovery room, recovery area, and recovery room nurse. You stay there for about an hour. We let you go home. Soon after surgery, we do like to see you back the next day, make sure there's no problems, usually a week after that, and then 2 or 3 months after that. It's probably the most satisfying surgery that we do, and we guarantee our work too.